Hi, my name is Catherine. I'm going to do a head-to-toe assessment on you today. Before I get started, I'm going to wash my hands. Can you tell me your name,
Hannah,
where you are,
my house,
and today's date?
Tuesday.
Okay, patience learned oriented times 3. Now, are you experiencing any pain on a scale of 0 to 10, 10 being the worst?
0.
Patient denies any pain. Next, I'm going to inspect your scalp now. Okay. Hair is evenly distributed, no signs of hair loss and no signs of lesions. Next, I'm going to inspect your ears. Ears are symmetrical. I'm going to check for any signs of drainage. No signs of drainage in both ears. Next, I'm going to inspect your face. Face is smooth, symmetrical, and is correct for ethnicity. Next, I'm going to inspect your eyebrows. Eyebrows are evenly distributed, no signs of hair loss, and eyelashes are evenly distributed, no signs of hair loss. Eyelids show no signs of ptosis. I'm going to inspect your conjunctiva now. Conjunctiva is pink and moist. Sclera is white, no signs of jaundice. I'm going to check for your corneal reflex now. Corneal reflex is present. Next, I'm going to check for your pupils. Pupils constrict to light. Next, can you follow my pen light? Pupils are equal, round, react to light, and accommodate. Next, I'm going to inspect your nose now. Nose is symmetrical. Can you lift up your head? No signs of drainage in the nose. Next, I'm going to inspect your lips now. Lips are pink, moist, no signs of cracking. Can you smile? Frown. Puff out your cheeks. Cranial nerve 7, facial nerve is intact. Next, I'm going to inspect inside your mouth. Open your mouth. Buccal mucosa is pink and moist. Teeth shows no signs of caries. No signs of gingivitis on the gums. Can you stick out your tongue? Cranial nerve 12, hypoglossal nerve is intact. Tongue is pink and moist. No signs of white patches. Can you say ah? Cranial nerve 9 and 10. Glossopharyngeal nerve and vagus nerve is intact. And tonsils are not present. Soft and hard palate is intact. You can close your mouth now. Next, I'm going to inspect your neck now. No signs of lesions. I'm going to palpate for any lumps. Okay, there's no lumps. Next, I'm going to palpate for your carotid pulse. Carotid pulse is +2 strength and is equal bilateral. Next, I'm going to check for your skin turgor now. Skin is elastic and no signs of dehydration. Next, I'm going to palpate for your body temperature. Body temperature is warm and is equal bilateral. Next, I'm going to inspect for your respirations now. No signs of shortness of breath, no signs of labored breathing. I'm going to auscultate your breath sounds now using my diaphragm. Each time I move to a spot, please take a deep breath with your mouth open. Deep breath. Deep breath. No signs of crackles or wheezing. Next, I'm going to palpate for your apical pulse. Your apical pulse is on your left side, 5th intercostal space, mid-clavicular line. Apical pulse is palpable. I'm going to listen to your apical pulse for a full minute with my diaphragm. Apical pulse is normal rhythm. Next, I'm going to auscultate your heart sounds now, starting with my diaphragm. I'm going to start at the aortic valve. Aortic valve is on your right side, between your second and third intercostal space. Your pulmonic valve is on your left side between your second and third intercostal space. Your tricuspid valve is on your left side between your fifth and sixth intercostal space. And your mitral valve on your left side, fifth intercostal space, clavicular. I'm going to listen to your heart sounds again, this time using my bell. Aortic. Pulmonic. Tricuspid. And mitral. No signs of murmurs or gallops. Now I'm going to inspect your abdomen. Abdomen is flat and symmetrical. I'm going to check. There's no signs of bruising or lesions on your abdomen. I'm going to auscultate your abdomen now, starting at your right lower quadrant with my diaphragm. Right upper quadrant, left upper quadrant, and left lower quadrant. Bowel sounds are active in all four quadrants. Now I'm going to palpate your abdomen, starting at your right lower quadrant. Please tell me if you're experiencing any pain. Light, deep, any pain?
No.
Right upper quadrant, light, deep, any pain?
No.
Left upper quadrant, light, deep, any pain?
No.
Left lower quadrant, light, deep, any pain?
No. Patient
denies any pain and no signs of mass. I'm going to inspect your upper extremities now. No signs of bruises, no signs of rash. Joints are equal, bilateral, and are symmetrical. I'm going to palpate for your upper extremities body temperature now. Upper extremities body temperature is warm and is equal, bilateral. I'm going to test your strength now. Put both arms up. Push against my arm. Good. Squeeze my fingers. Good. Strength is present and grip is present, is equal, bilateral. Next, I'm going to palpate for your radial pulse. Radial pulse is palpable and it's +2 strength. Next, I'm going to check for your capillary refill on your finger. Capillary refill is rapid and is less than 3 seconds. Now I'm going to inspect your lower extremities body temperature. I'm going to inspect your lower extremities now. No signs of rashes, bruises. Joints are equal, bilateral, and is symmetrical. I'm going to palpate your lower extremities body temperature now. Lower extremities body temperature is warm and is equal, bilateral. I'm going to inspect your strength now. Push it against my hands. Good. Flex your right foot, left foot. Strength and flexion is present and is equal, bilateral. Next, I'm going to check for pretibial edema. Pretibial edema, no signs of edema, no signs of indentations. Next, I'm going to palpate for your posterior tibial pulse. Posterior tibial pulse is present and is +2 strength. Next, I'm going to palpate your dorsalis pedis pulse. Dorsalis pedis pulse is +2 strength. Next, I'm going to check for your capillary refill on your great big toe. Capillary refill is rapid, it's less than 3 seconds. Do you have any questions today?
No.
All right, thank you for your visit, Hannah.